Hello, this is Dr. David Oster, and this is a presentation that I put together reviewing pendulum exercises that should be done following shoulder or rotator cuff surgery, or can be done following shoulder injuries. And this video was put together in conjunction with Dennis Martin and Wes Riggs of Proactive Physical Therapy. Now, pendulum exercises should be done following rotator cuff surgeries, or can be done following other types of shoulder surgeries or injuries. Now, this exercise is a passive exercise, and what that means is that the muscles should be completely relaxed so that as you're doing these exercises, you're not involving any of the muscles around the shoulder itself. Activating these muscles can put tension on the repair and increase the likelihood that the repair can fail. So it's important to let the muscles relax and let gravity do the work. Now, when you're doing these exercises, here are some of the key points. First of all, you want to lean over and support your body with the opposite arm. The non-surgical or the non-injured arm should be used for support. So you want to lean over and place that hand and arm on a table or a chair to let your body relax. You'd like to get the back somewhat parallel to the ground. The farther you lean over, the higher you're lifting your arm. Once you get in that position, then let your arm dangle, and it's important to let the arm and the shoulder relax. Once you feel relaxed, then start some small circles in either a counterclockwise or a clockwise direction. And it's important just to start with small circles and then gradually enlarge the circles, but you don't want to do them so that it has a large arc of motion. And you'll see on the video the proper way to do that. Now you want to keep your back and your chest steady, because if you're moving your back and chest, then the motion that you're getting is probably from your back and chest. You want to try to keep the back and chest steady so that when you're moving your arm, all the motion is coming through the shoulder and not from you moving your back around. Now you want to try to do these exercises approximately 4 times a day: breakfast, lunch, dinner, and before you go to bed. And you want to try to do these exercises approximately 5 to 10 minutes. You want to do it long enough so that you feel like the shoulder is loosening up and that stiff feeling is going away and your pain is gradually improving. It's important to do these exercises so that you avoid the stiffness that can be associated with shoulder surgeries. You also want to get started on these exercises as soon as possible. You may think that by delaying these exercises that it will actually be easier to get your shoulder moving. However, the longer you wait to do the exercises, the more scar tissue will build up in the shoulder and the harder it will be to regain your range of motion again. So again, it's important to get started on these exercises as soon as possible. The following video reviews these pendulum exercises and shows you the proper techniques to do them.
So early after a rotator cuff repair, you can begin immediately when you get home a pendulum maneuver. And this is very simple to do. You're going to be in your sling. You just unfasten your sling from the wrist, and if there's an arm component. You want to be passive, so if Wes has an injured right shoulder, he's going to use all left arm here. He's going to let his arm out of the sling, let it come down. He's going to support with his uninvolved arm onto a table or a countertop that's stable and safe. His back is going to be relatively flat, and he's just going to let his arm hang, and he's just going to start a clockwise or a counterclockwise motion. It doesn't need to be a large diameter circle, just a controlled range of motion. He can go a little bit larger than that probably, but not much, and just move his arm gently into a pendulum type maneuver. This should be very, very comfortable. If it's painful, you're not doing it correctly. Clockwise, counterclockwise, small controlled ranges of motion. It doesn't need to be a wide range of motion that's out of control. That's too big and not enough control. You can go with a little bit more pace potentially than that, but just take what you're comfortable with. It should be very good at pacifying pain, and it should be very comfortable to do. You should do this 4 times a day, breakfast, lunch, and dinner, and right before bed. And you can, if you're having trouble sleeping at night, you're up out and about, this is a way to potentially pacify some night pain that you may be getting. Another exercise to do while out of the sling is just bending and straightening the elbow with the assistance of the other arm. So it should again be passive. The right arm is not doing anything, it's the work of the left. With recommendation of your doctor, you can do active motion as well.
So that was a video reviewing the proper ways to do pendulum exercises. So to review the key points: lean over and support your body with the opposite or non-surgical arm. Try to get your back somewhat parallel to the ground. Again, the farther you lean over, the higher you're lifting your arm. Let the shoulder and arm relax, and then start small circles with your arm in either a clockwise or counterclockwise direction. It's important to keep your back and chest steady, and try to do these exercises 4 times a day: before breakfast, before lunch, before dinner, and then before you go to bed. It is also important to review the postoperative sheet that you received after surgery. If any of the instructions on that sheet are different than what you see in this video, follow the instructions that you received after surgery. I hope you found this presentation helpful. If you'd like to look at other orthopedic procedures, please visit my website, davidostermd.com, for an evaluation or office appointment or follow-up. 303-214-4500. Thank you.